The ideal thing is that you want to make sure that you're dressed in layers. You want to have a layer against your skin that's going to wick moisture away, that's going to remove moisture away, not only in your socks, but gloves, undershirts, long underwear, those sorts of things. You need to be conscious, again, layers to keep things warm. These days there are electric gloves, that little battery powered for gloves, for socks, for vests, things like that can be incredibly helpful. There are the chemical agents, the hot packs that people can use. You have to be thoughtful and careful with things like that, because you can actually, areas that don't have a lot of sensation, you can cause a thermal or a heat injury to those areas as well. And we see that sometimes in people, for instance, who have diabetes, who have poor sensation to an extremity. They can put something that they think is helping, and it can actually cause problems. So I'd say overall, the most important thing is you need to dress for the conditions, and you need to be thoughtful. If you have the opportunity to spend part of the time doing the activity, whether that's watching a football game, whether that's ice fishing or whatever you're doing, if you have an opportunity to warm up for part of it and then go back out, that would be something that would also make it less likely that you're going to get a frostbite injury. But be very conscious of all of the areas that are exposed. As I said earlier, noses, ears, extremities, those are areas that are more commonly, can get a frostbite injury if they're not covered, if they're not protected. If you think about it, the tip of your nose, your ears, the blood supply is going to be a little less robust to those areas. So if you're not paying attention, you're not wearing a hat, you're not wearing, in these really cold temperatures, sort of a ski mask, kind of face mask, those areas will get extremely cold and can freeze. The people that I think you really need to think about the most would be children, because children may not recognize what they're feeling, how severe it is, or people may not honestly always be paying attention to them. The elderly, so anybody who's older, we know blood flow to extremities isn't as good. People who have what we would call comorbidities, so say the individual who has diabetes, who has blood supply problems to areas, maybe they've been a long-term smoker and they've got blood supply problems to especially their extremities. That would be another group. So there's really a large, it's really just about everybody needs to be careful. And as somebody who has teenage boys, young men tend to be a group that don't always think as clearly when they're at things. They get very excited. And, we've seen people who they think it's maybe going to get them on TV taking their shirts off in the cold. So it's really, it's being conscious of what the risks are and being careful about doing everything you can to not suffer an injury. You have to have an extreme sense of urgency. So different tissues have different abilities to survive after having suffered a cold injury. Muscle, as an example, is extremely sensitive. So it's different if you just have, say, a finger versus if you have an arm or if you have a lower leg. If you don't treat those muscles, if you aren't able to get blood supply and get them warmed sufficiently quickly, within, generally it's going to be less than an hour before there's going to start to be a degree of long-term damage. If you look at somebody, and you can see if somebody, say you're looking at their face and you see their cheeks are developing white patches or the tip of their nose, you've got to tell them, because they may not notice it. So you need to sort of help them. We need to help each other.